how do you diagnose peripheral arterial disease?
So after the physical examination, which most of the time, unless there's a glaring sign like the hair loss or wounds on the legs, we do a non-invasive testing, where we either look at the anatomy in the artery to see whether the plaque is present and how the blood is flowing down the leg, or we can do a physiologic test where we do blood pressure cuffs, comparing the blood pressure measurement of the arm to different areas in the leg, 3 different spots in the leg, in the thigh area, right above the knee and below the knee, which is called an Ankle-Brachial Index, where we find out what it is, a waveform difference between the arm pressure and then the leg pressure.
Interesting. So you do an ABI first to figure it out, or you're doing a physical exam first to see if there's wounds or anything?
Yeah, physical exam, and then you can do a physiologic study first. And if the physiologic study has any abnormality, then you can go and do the anatomical ultrasound study where you look at the detail of the artery itself, ultrasound.
So ultrasound is going to basically show you a picture of how that vessel is functioning.
Yes.
Inside, without having to do, again, it's a non-invasive test.
Yes, it's non-invasive.
So it's a wand that's going over a leg with some jelly that shows them flow, or shows you flow.
Yes.
Within that patient.
Correct.
And plaque and things like that will show up on that test.
Correct.
Okay. So if a patient comes in, they are found to have plaque under ultrasound. Does that necessarily mean that they're doomed, or at that point you can judge whether you can manage this pharmacologically, meaning with medications without having to do any intervention, or walk me through that thought process?
So it depends on the patient's symptoms and how it's affecting their lifestyle and how bad the disease is. So if the patient has symptoms that is affecting their lifestyle and is debilitating, then and we do find that there is blood flow is being limited by the plaque, then we will then offer both therapy and intervention to the patient.